Health authorities in 2 states this morning are racing to trace and test hundreds of people. Public health alerts have been issued for several exposure sites in Sydney after a hotel quarantine worker returned a positive test late on Saturday. Further north, Brisbane's Hotel Grand Chancellor will stay in lockdown until at least Tuesday as officials try to determine if a return traveller caught the virus while in quarantine.
But there's good news too, with Queensland officials confident they've traced most of the contacts of a doctor who appeared to have caught the virus while treating COVID-positive patients. Our reporter Ruby Cornish is in Sydney and Michael Rennie is in Brisbane for us today. So Ruby, we're waiting to find out more about this hotel quarantine worker case today.
G'day, Mads. That's right. We should be hearing more from health authorities today about how they're going with tracking and tracing and genome sequencing, trying to identify the source of this infection, though authorities believe it came from someone who was in hotel quarantine. New South Wales Police are helping with that contact tracing as well, conducting interviews and reviewing CCTV footage. We were going so well here in New South Wales, 55 days without a locally acquired case, but now we have this 47-year-old quarantine hotel security guard who tested positive late on Saturday night and then again on Sunday morning. It was confirmed, so his numbers will be included in today's coronavirus statistics. Now, under the current rules, all quarantine workers are tested at the end of their shifts. And this man, that's what happened to him. He works at a number of hotels around Sydney, and the two of concern to authorities are the Sofitel Wentworth here in the Sydney CBD and also the Mantra Hotel nearby in Haymarket. Now, he mostly worked on the weekends, but through the week he has an office job. We haven't been told anything about that, so we can assume that's not of concern to authorities. Now, interestingly, this man had actually received a vaccination. He got his first dose of the Pfizer vaccine on the 2nd of March and was due to get his second one this week. Now, 130 of his co-workers are now in isolation, as well as 4 close household contacts of his. All of them have so far tested negative. Now, this man was out and about for about a week after he was infected, mostly around the Sydney CBD and in the city's south. There are a number of venues that have put on alert. If you were at the Pancakes on the Rocks in Beverly Hills from 10:45 to 12 on Saturday morning, you are a close contact. You need to get tested and isolate for 2 weeks regardless of that test result. There are some other venues, a cafe in Hurstville, the Bexley Aquatic Centre, a Korean restaurant and a 7-Eleven in Haymarket. All those details are on the New South Wales Health website. The other thing that everyone will be asking now is what happens to COVID-19 restrictions here in New South Wales. They were last relaxed on the 26th of February. We were told that the government would look at them again in 2 days' time on the 17th of March and that we might be able to stand up with drinks in venues. But that, of course, that's always subject to developments like this, so we can't get our hopes up just yet, Mads.
OK, we'll have to wait a bit longer for that one. To Queensland now, Michael Rennie is there. And Michael, the hotel behind you is still under lockdown today.
Morning, Mads. Yes, it is, and it's under 72 hours lockdown. Now, we're actually hearing someone this morning actually yelling over the balcony this morning in frustration of this current lockdown here this morning. That was sparked after 2 people tested positive to COVID-19 last week. They were taken to hospital and it was determined that they had the UK strain of this virus. The doctor that then treated the patients contracted the virus. This doctor was out in the community on Thursday and then went to get tested on Friday after coming down with some symptoms. Contact tracing began. Over 300 people have been traced so far. That includes people at 4 venues that she visited and also staff and patients at the hospital as well. There were some questions raised about the personal protective equipment that this doctor was using at the time. Was it adequate? Queensland Health says it was, but they won't go into specifics about what that equipment exactly was. Meantime, there's been another case here at the Grand Chancellor Hotel that was recorded on Saturday. That case has been linked to the first case that infected this doctor, and both people were staying on the same floor. This person was also in day 12, Mads, of their quarantine period. So really the exit test, getting ready to leave the hotel. So a lot of frustration from the guests here this morning. You can understand that, particularly those who were getting ready to leave. We are expecting to get some results today from some of that testing, which should go a long way to deciding whether Brisbane goes into another lockdown or stays open.
Michael, thank you very much. And Ruby in Sydney, thanks to you too.